13 signs of liver disease that you can see. Liver disease is a growing health crisis in the U.S., affecting over 100 million Americans. Conditions like fatty liver disease, hepatitis, and cirrhosis are on the rise, largely due to poor diet, alcohol consumption, and sedentary lifestyles. What's even more concerning? Many people have no idea their liver is in trouble. The liver is a tough organ. It keeps working silently until the damage becomes severe. By the time symptoms appear, it might already be too late to reverse the damage. What makes this even more alarming is that many of these conditions could be prevented with simple lifestyle changes. The liver is incredibly resilient and has an amazing ability to regenerate, but it has its limits. When those limits are exceeded, conditions like fatty liver disease, hepatitis, and even cirrhosis start to develop. The worst part? Most people don't find out they have liver disease until it's in an advanced stage. That's because the early signs are subtle, easy to ignore or mistake for fatigue and everyday stress. But here's the thing, your body does give you clues, and some of them show up on your skin, nails, and even your eyes. Knowing how to spot these signs can mean the difference between catching the problem early or finding out when it's too late. And if you think this doesn't apply to you, think again. Small, everyday habits might be putting your liver at risk without you even realizing it. The good news? Once you know what to look for, you can take action before things get worse. Imagine catching liver disease early, before it leads to irreversible complications. Simple lifestyle changes, regular checkups, and paying attention to your body's signals can make all the difference. So stay with me because what you're about to learn might just surprise you. In this video, we're diving into the 13 warning signs of liver disease, many of which are completely unexpected. Some of these clues may seem unrelated at first, but they can reveal serious problems long before major symptoms appear. And before we get started, if you appreciate science-backed health content, take a moment to like this video, subscribe, and share. It's free, and it helps us keep bringing you valuable insights. And speaking of signs, have you ever noticed strange changes in your fingernails? You might be surprised at what they can reveal. Mjörk's lines and Terry's nails. Your nails can reveal more about your health than you might think, especially when it comes to liver disease. Two distinct nail changes, Mjörk's lines and Terry's nails, can be red flags for serious liver problems. Mjörk's lines appear as two or more white bands running horizontally across the nails, staying in place rather than growing out with the nail. These bands are caused by low albumin levels in the blood, a condition often seen in liver disease where the liver struggles to produce enough proteins. Unlike normal nail ridges or marks from an injury, these lines don't move as your nails grow. Then there's Terry's nails, a condition where most of the nail turns pale, leaving just a thin, darker band near the tip. This happens when the liver fails to regulate blood circulation properly, causing changes in the nail bed. With reduced oxygen supply and protein imbalances, the nail takes on this distinct, washed-out appearance. While aging can cause subtle changes in nail color, Terry's nails are far more dramatic and are often linked to liver cirrhosis, diabetes, and heart failure. If you notice either of these changes, don't ignore them. While nails might seem like a small detail, they can give early warnings of something much bigger happening inside the body. One thing you do want to see on your nails is the lunula, the small, crescent-shaped white area at the base of the nail. A visible lunula is often a sign of good circulation and overall nail health. If yours are suddenly shrinking or disappearing, it might be worth paying attention. And speaking of warning signs, let's talk about a strange yet telling change that happens to the shape of your fingers: clubbing. Have you ever noticed someone with fingertips that look swollen and rounded, almost like tiny drumsticks? This is called clubbing, and while it may seem like just an odd quirk, it can actually be a sign of serious health issues, including liver disease. Clubbing happens when the tips of the fingers swell and the nails start to curve downward. This occurs because of changes in blood flow and oxygen levels, often linked to chronic conditions like cirrhosis, lung disease, and even heart problems. The key thing to watch for is a gradual thickening of the fingertips and increased curvature of the nails over time. So why does this happen? When the liver isn't working properly, it can lead to abnormal levels of proteins and hormones in the blood, affecting circulation. Over time, this triggers the growth of extra tissue at the fingertips, causing the nails to change shape. One simple way to check for clubbing is the Shamroth's window test. Just put the tips of your thumbs together. If there's a small diamond-shaped gap between the nails, that's normal. If the gap is gone and the nails are pressing tightly against each other, that could be a sign of clubbing. Although clubbing isn't always due to liver disease, it's a warning signal that something in the body isn't right. If you notice your fingers changing shape, especially alongside other symptoms like fatigue or swelling, it's time to take action. And speaking of swelling, there's a condition that causes a dramatic buildup of fluid in the abdomen: ascites. Imagine feeling bloated, like you've just eaten a large meal, but no matter what you do, the sensation doesn't go away. That's what ascites feels like. Ascites is the abnormal buildup of fluid in the abdomen, and it's a common complication of liver disease, especially cirrhosis. When the liver becomes damaged and struggles to function, it can cause blood flow to back up in the liver, leading to increased pressure in the veins. This pressure, combined with a lack of protein production from the liver, results in fluid leaking into the abdomen. If someone's abdomen becomes noticeably swollen, hard, or tender, ascites could be at play. It's not just discomfort. It can lead to difficulty breathing, as the swollen abdomen can push against the diaphragm. You might also notice weight gain, even though it's just fluid retention, not actual fat. A healthcare provider may conduct an ultrasound or tap on the abdomen to check for fluid buildup. If left untreated, ascites can lead to serious complications like infections or kidney failure. So what can you do if you suspect ascites? The first step is to see a doctor for an accurate diagnosis. While diet changes, like reducing salt intake, can help manage symptoms, medical treatments such as diuretics or even draining the fluid may be necessary. But ascites isn't the only sign that something might be going wrong with your liver. Another unusual sign involves the veins in your stomach, and it's called caput medusae. If you've ever noticed visible veins swirling across someone's abdomen, almost like a web, that could be a sign of a condition known as caput medusae. This occurs when the veins around the abdomen become enlarged and twisted, giving the appearance of a Medusa's head, a reference to the mythical creature with snakes for hair. Caput medusae is a result of increased pressure in the portal vein, which is responsible for carrying blood from the digestive organs to the liver. When the liver is damaged by disease, such as cirrhosis, it can block this blood flow, causing veins to dilate and form these conspicuous patterns. The veins are often most visible around the navel and may look like a network of thickened, bulging lines. This occurs as the body tries to find alternative pathways for the blood, bypassing the blocked liver. If you spot caput medusae, it's a red flag that liver function is severely compromised. It's usually accompanied by other signs of liver disease like swelling and jaundice. If you or someone you know notices these prominent veins, it's time to take action. While caput medusae itself may not cause pain, it indicates the presence of portal hypertension, a condition that can lead to life-threatening complications. Now, speaking of complications, there's a condition that causes more serious internal bleeding due to the liver's compromised function: varices. Varices are enlarged veins, typically found in the esophagus or stomach, that occur as a result of high blood pressure in the veins that supply the liver. This condition is closely related to portal hypertension, which happens when blood flow to the liver is obstructed, often due to liver diseases like cirrhosis. As the blood pressure rises, the body attempts to reroute blood flow through smaller veins, which can become enlarged and swollen, leading to varices. These varices are most dangerous when located in the esophagus, where they are prone to rupture and cause severe bleeding. The tricky part about varices is that they often don't show symptoms until they're dangerously enlarged. A person with esophageal varices may not even feel any discomfort until they start bleeding, which can lead to vomiting blood, a very serious emergency. Even if they're in the stomach, they can be hard to detect without medical imaging. If someone has cirrhosis or another liver condition, their doctor will likely monitor for varices regularly. The good news is that varices can often be managed with medical treatment before they cause a major issue. Doctors may recommend medications to lower blood pressure in the veins, or they may perform a procedure to reduce the size of the varices and prevent bleeding. But what about a sign that appears more on the skin? Something you can actually see with the naked eye? Let's talk about palmar erythema. Palmar erythema is a condition where the palms of the hands become red or flushed, often in a blotchy pattern. This can be an early sign of liver disease, particularly cirrhosis. The redness occurs due to changes in blood flow near the surface of the skin, caused by hormonal imbalances linked to liver dysfunction. Normally, the liver helps break down hormones in the body, but when it's not working properly, certain hormones like estrogen can accumulate and cause the blood vessels in the palms to dilate, leading to that reddish appearance. What's interesting about pulmonary erythema is that it's often seen in people with chronic liver disease, but it may also be linked to other health conditions, such as pregnancy or autoimmune disorders. So while red palms may not always point to liver problems, if it's combined with other symptoms like swelling, fatigue, or jaundice, it can be a strong indicator that the liver is struggling. If you notice pulmonary erythema, it's important not to panic, but it's a good idea to get it checked out, especially if other symptoms are present. Your doctor may check liver function through blood tests or imaging studies. In the meantime, managing liver health with a balanced diet, regular exercise, and avoiding alcohol can make a huge difference. But that's not the only skin-related sign to be aware of. There's another one you might notice that looks like tiny red spots on the skin. Let's talk about spider nevi. Spider nevi are small red spider-like blood vessels that appear on the skin, usually on the face, neck, or chest. These tiny web-like formations occur when the blood vessels near the skin surface dilate, forming a pattern that looks similar to a spider's legs. The most common cause of spider nevi is liver disease, which can affect the body's ability to process hormones. Just like pulmonary erythema, the hormonal imbalance caused by liver dysfunction leads to the widening of blood vessels in the skin, causing these distinctive markings. What makes spider nevi particularly interesting is that they're not just a cosmetic concern. In fact, they can be an early warning sign that liver damage is present. They often appear in people with chronic liver conditions, but they may also develop in those with hormonal changes, like during pregnancy or as a side effect of certain medications. If spider nevi appear suddenly and in large numbers, it's worth considering a visit to the doctor to rule out liver issues. While spider nevi themselves don't require treatment, they can be an indication that liver disease is progressing. Addressing the underlying condition, whether it's through lifestyle changes, medical treatment, or managing any other contributing factors, can prevent further skin changes. Speaking of liver disease progression, another serious sign to watch for is muscle wasting. Let's take a closer look at this. Muscle wasting, or sarcopenia, is a condition where the muscles become progressively weaker and smaller. The liver plays a vital role in protein metabolism, and when it's not functioning properly, it becomes more difficult for the body to build and maintain muscle mass. This can lead to a noticeable decrease in muscle size and strength, making everyday activities like climbing stairs or carrying groceries feel like a huge challenge. What's even more concerning about muscle wasting is that it's not just about aesthetics, it directly impacts a person's quality of life. A weakened body can make recovery from illness or surgery more difficult and lead to more frequent falls or injuries. The underlying cause of muscle wasting in liver disease is often a combination of poor nutrition, inflammation, and hormonal imbalances. For example, people with cirrhosis may have trouble absorbing nutrients, which contributes to muscle loss. Fortunately, muscle wasting can be managed with proper treatment, including improving nutritional intake and engaging in physical therapy or strength-building exercises. A balanced diet rich in protein combined with regular resistance training can help slow the progression of muscle wasting. However, if muscle wasting becomes severe, it's important to seek medical advice to adjust the treatment plan. And speaking of treatments, there's another complication related to the liver that involves changes to the skin, Dupuytren's contracture. Let's dive into that. Dupuytren's contracture is a condition where the tissue beneath the skin of the palms thickens and tightens, causing the fingers to bend inward toward the palm. This condition can be frustrating and limiting, making it difficult to fully extend the fingers. While Dupuytren's contracture is primarily known as a genetic disorder, it is also more commonly seen in individuals with chronic liver disease. The connection between the two lies in the body's altered collagen production, which is often influenced by liver dysfunction. For individuals with liver disease, Dupuytren's contracture typically develops slowly over time. Initially, a small nodule or lump may appear in the palm, which eventually turns into the thickening of the tissue, causing the fingers to curl. It's important to note that Dupuytren's contracture doesn't cause pain, but the functional limitations can impact daily activities such as typing, driving, or even gripping objects. While there is no definitive cure, treatments like physical therapy, corticosteroid injections, or in severe cases, surgery can help alleviate symptoms. If you're noticing a gradual loss of finger mobility or developing lumps in the palm, it's worth discussing with a healthcare provider, especially if other signs of liver disease are present. A doctor may recommend physical therapy or other interventions to help slow the progression of the contracture. As we continue discussing the signs of liver disease, one of the most serious complications to watch for is hepatic encephalopathy. Let's explore that next. Hepatic encephalopathy is a condition that occurs when the liver is no longer able to remove toxins from the bloodstream, leading to a buildup that affects brain function. In the early stages, symptoms can be subtle, such as difficulty concentrating or forgetfulness. However, as the condition progresses, it can lead to confusion, disorientation, and even coma. Hepatic encephalopathy is often seen in people with advanced liver disease, particularly cirrhosis. It's the result of a liver that can't properly process ammonia, a byproduct of protein metabolism, leading to toxic levels that impact brain function. What makes hepatic encephalopathy particularly dangerous is that it can progress rapidly if left untreated. The toxins that build up in the bloodstream can interfere with normal brain function, causing a range of mental and neurological symptoms. In severe cases, individuals can experience drastic changes in behavior, such as agitation or a complete inability to communicate. If you or someone you know experiences signs of confusion, sleep disturbances, or changes in behavior, it's essential to seek immediate medical attention. Treatment for hepatic encephalopathy typically involves reducing the levels of toxins in the blood. This may include medications like lactulose, which helps reduce ammonia levels, or antibiotics to address any infections that may be contributing to the condition. In some cases, liver transplantation may be the only option. If you suspect someone is showing signs of hepatic encephalopathy, it's important to act quickly, as early intervention can make a significant difference in the outcome. Next, let's take a closer look at jaundice, another key sign of liver disease. Jaundice is one of the most noticeable signs of liver disease, and it occurs when the liver is unable to process bilirubin, a yellow pigment produced when red blood cells break down. When bilirubin builds up in the bloodstream, it causes the skin, eyes, and mucous membranes to take on a yellowish hue. While jaundice can be caused by a variety of conditions, it is most commonly associated with liver diseases like hepatitis, cirrhosis, and bile duct obstructions. The severity of jaundice can vary, with some individuals only experiencing a slight yellowing of the skin, while others may develop more pronounced symptoms. The appearance of jaundice can be a clear signal that the liver is struggling, and it's a sign that should never be ignored. It often comes hand in hand with other symptoms such as fatigue, dark urine, and pale-colored stools. If you notice yellowing of the skin or the whites of the eyes, it's crucial to seek medical advice right away. Early intervention can help manage the underlying cause of jaundice, whether it's liver disease, a bile duct obstruction, or another condition that affects bilirubin processing. Treatment for jaundice depends on the underlying cause. In cases of liver disease, managing the liver condition itself is key. For example, if jaundice is caused by cirrhosis, the focus will be on controlling the progression of the liver damage. If it's caused by a bile duct obstruction, surgery or other procedures may be necessary to remove the blockage. Jaundice may subside once the liver starts functioning properly again, but it's important to follow a healthcare provider's guidance closely to avoid complications. Up next, let's dive into bruising, another sign that can indicate liver issues. Bruising is another sign that can point to liver disease, particularly when the liver's ability to produce essential proteins is compromised. The liver is responsible for producing clotting factors that help the blood to clot properly. When liver function is impaired, these clotting factors may be produced in insufficient quantities, leading to easy bruising even from minor bumps or injuries. People with liver disease often notice that their bruises appear more frequently and may take longer to heal than they would in someone with a healthy liver. In addition to bruising, you might also notice that the bruises are more severe than usual, with darker or larger spots, or that bruises form without an obvious cause. This is because the blood vessels under the skin may become more fragile due to liver dysfunction. Sometimes the bruises may be accompanied by other signs of liver disease, such as jaundice, fatigue, or unexplained weight loss. If bruising is excessive or appears alongside other symptoms, it's important to consult a healthcare provider to assess liver function and explore potential underlying causes. Preventing excessive bruising typically involves managing the liver condition itself. In some cases, medications or supplements may be prescribed to help improve liver function and enhance clotting. However, in more advanced cases of liver disease, treatment may focus on slowing down the progression of the disease to prevent further damage to the liver's ability to produce clotting factors. As we continue, we'll explore more unexpected symptoms like itching that can also indicate liver problems. Itching, also known as pruritus, is an often unexpected symptom of liver disease that can leave many people confused. It's not the first thing that comes to mind when you think about liver problems, but it can be a clear sign that something is wrong. Pruritus occurs when bile salts build up in the bloodstream, often as a result of liver dysfunction. Normally, the liver removes excess bile from the body, but when the liver is compromised, these bile salts accumulate and can cause irritating itching, especially on the hands, feet, or upper body. The sensation of itching can range from mild to intense and might come and go, or it could be persistent. What makes this symptom even more frustrating is that scratching doesn't relieve the itch. In fact, it can often make it worse. Itching may worsen at night or in hot weather, making it even harder to sleep. For people dealing with liver disease, this unexpected symptom can impact quality of life, leaving them feeling constantly uncomfortable. If you're experiencing unexplained itching, especially if it's accompanied by other signs like jaundice, fatigue, or dark urine, it's important to consult a healthcare provider. Pruritus can often be managed with medications that help reduce the buildup of bile salts, but the underlying liver condition needs to be addressed as well. So keep an eye out for this unexpected symptom, and don't be afraid to bring it up with your doctor. Prevention is key when it comes to liver health, and the best way to protect your liver is through a healthy lifestyle. Eating a balanced diet, exercising regularly, and avoiding excessive alcohol are crucial steps. Maintaining a healthy weight also reduces the risk of fatty liver disease, which can progress to more serious liver issues. Routine checkups are equally important, as they allow for early detection of liver problems, especially since many conditions don't show symptoms until they're advanced. In addition to healthy habits, avoiding exposure to harmful toxins and staying on top of vaccinations for hepatitis A and B can help protect your liver. Regular blood tests are essential for those with higher risk factors, like obesity or a history of alcohol use. By staying proactive, you can prevent liver complications and safeguard long-term health. Now that you know some of the unexpected signs of liver disease and the steps to prevent it, it's time to take action. Are you noticing any of these symptoms in yourself or someone you care about? Don't ignore them. Early detection can make all the difference in managing liver health. Make sure to prioritize a healthy lifestyle, regular checkups, and staying aware of any warning signs. If you found this video helpful, don't forget to hit that subscribe button and turn on notifications so you can stay informed and continue learning how to take control of your health. Thanks for watching, and see you in the next video.